Hello and welcome to Rajya Sabha Television. You're watching COVID-19 India Fights Back. I'm Frank Razan Pereira. In his address to the nation on October 20th, Prime Minister Narendra Modi assured that every citizen of India will be administered COVID-19 vaccine. Prime Minister Modi wants to make use of India's experience of disaster management and conducting elections across the length and breadth of the country to put in place an efficient system for vaccine delivery and administration. India has 29,000 storage points, 83,000 deep freezers, 736 district stores and 258 cold rooms to store vaccines, but they have to be scaled up further for India to vaccinate all its people. In this edition of COVID-19 India Fights Back, we will analyze India's vaccine administration plan for COVID-19. Joining me on the program today are Dr. Samiran Panda, Scientist G and Head ECD Division ICMR, Dr. Archisman Mohapatra, Epidemiologist, and Dr. Madhu Gupta, Professor, Department of Community Medicine and School of Public Health, PGIMER, Chandigarh. Thank you to all my guests for joining me on this telecast. All right, Dr. Panda, I'd like to begin the program with you first. Really, what's the plan as far as administration of vaccines to the people of India is concerned?
Well, thank you. Vaccination prevents infection. Just availability of vaccine does not. So there is a difference between vaccines being available and vaccination happening. It sounds easy, but it does require considering a whole lot of non-vaccine related issues as well. Those issues are linked issues, but not necessarily the product, the vaccine per se, or its quality. So let's assume that there is a vaccine which is ready to go, ready to be administered to people. Now, those vaccine, we are not talking about any particular vaccine. There could be 2 or 3 different vaccines which might be available in India, and each one of them might have different storage requirement. So for India, the best scenario would be anything that can be preserved in 2 to 8 degrees centigrade, because that's the way we generally preserve vaccines as a part of the universal immunization program, an expanded program of immunization, the vaccines that are administered to children. But here we are talking about a vaccine which is not going to go to children, but also the adults, and particularly certain groups of workers need to be prioritized. So although one would think of mass vaccination or everybody getting a vaccine, but that might not be necessary right at the beginning. So if the priority needs to be set up, then those who have more vulnerability for infection, those groups need to be prioritized. And on the other hand, those groups who after getting infected run the risk of death due to the associated comorbidities, they need to be prioritized first. So although the vaccine should be available for every Indian, probably it will make much more epidemiological sense and public health sense if prioritization is done and the vaccination goes in a phased manner, where not only availability of the vaccine, but also the storage conditions and the network to be able to deliver the vaccine. And if it is a 2-dose vaccine, whether everybody who received the first dose were also given the second dose, ensuring that would be necessary.
Absolutely. It's a long drawn out process. There are several things that need to come into place. It has to be like, it all has to work like a well-oiled machine, and only then can we see it being completely successful. All right, Professor Madhu Gupta, let me come across to you now. As far as planning is concerned, how important is planning to carry out a drive like this, and what goes into, actually administrating something on such a large scale?
Yeah, first of all, thank you so much for inviting me here. And this is a very pertinent question. And planning is the most important part when we are talking about implementation of the vaccine, ultimately administration. So planning is done at each and every step of healthcare delivery system. So we have to start from the village level, then move on to the sub-center level, then primary health centers, then community health centers, district health level, and the state level. And who all are the stakeholders in this? So, starting from the state level officials to district level officials, program managers, medical officers, we have ANMs, we have ASHAs. So all needs to be oriented, and training plan has to be formulated in the state, district, block, PSC, and sub-center level. So in a cascade manner, starting from the national level, we have to train, first of all, the human resource, that this is a vaccine which has come up. The only advantage with India is that, and almost for several other countries, that we have been administering vaccine for the last 50 years. And we have a very trained staff. And immunization is one of the very successful program which we are running. And recently we have intensified Mission Indradhanush and have the experience of implementing Indradhanush programs. So our staff is very much sensitized, especially when they have to start any additional immunization programs, like we recently did MR vaccination campaign. But in addition to those in the stakeholders in the health system, we need to sensitize other stakeholders like community representatives, civil societies, NGOs, so that it is coordinated. And whenever this vaccine comes, the community is also, although there is a lot of demand in the community, but they're also acceptable to receive this vaccine. Another thing which is very important, cold chain. So the maintenance of the cold chain is highly very important. And second is the storage. That storage facility, although below district level, there is, I do not predict that there will be any issues, but at the higher level, we need to have more storage facility, which will be required. So, and also how the vaccine at the village level, how the vaccine is going to be transported to the last consumption level. So, and who are going to administer it? So after we ensure that vaccine is maintained in a cold chain, then how it is going to be administered? Like we have intramuscular route most likely, and there will be 2 doses, and also then monitoring of the side effects, if any, from the vaccine. So that is already, we have adverse event following immunization surveillance, which is already going on in the country, and we can take use of that existing strategy which we have already in the country.
Absolutely. There are many things that need to come in place. That's something that we've already spoken about over the last 7 or 8 minutes or so. Let me take one point that you're making forward with Dr. Mohapatra now. Dr. Mohapatra, as far as immunization drives of the past are concerned, and the ongoing ones as well, what is it that they have taught us, and how can we prepare for the pandemic and the upcoming vaccine as a result of what we've learned from the past?
India has a very rich legacy of breaking very major barriers in terms of vaccine administration. So we have encountered one of the toughest fights in our polio experience, handling vaccine hesitancy as well. But here the situation is a bit different, because community is already waiting the arrival of a vaccine. And vaccine adds to our other approaches, that is our ongoing research on therapeutics, our ongoing research on handling community reactions, sociological, socio-behavioral reactions. Here, we have the vaccine thing also rolling out. And if we look at this entire experience, the equity dimension must be handled very carefully, because when we are prioritizing one particular group for a vaccine administration, the others should cooperate and wait. And that has implications of very stringent data monitoring, prioritization, as Dr. Panda has already pointed out. Those aspects must be taken care of. We have a very dense network of vaccine volunteers across the country. And that's also where we need to engage more effectively with other stakeholder constituencies, the private sector, the civil society organizations, media people. So all those effective engagement will definitely lead to some kind of mobilization in the community, in which we are more patient as the vaccine is being rolled out across the country. At the same time, because we are a huge population and the vaccine will be rolled out across the country, there would be some reports here and there, lay reports, which must be handled more patiently. So community reactions must be gauged, preempted, and handled before we roll out at scale. So all that is being taken care of in terms of the wide consultations that the government is already making. So we have a high-level national expert committee which is already looking into vaccine administration. We have the National Technical Advisory Group on Immunization, which is the Apex Advisory Group on Vaccines for the Government of India. It has further mechanisms of having standing technical subcommittees which are looking into COVID-19 per se, and they are advising the government. So all these legacies and experiences, as well as evolving experiences, they will be handled with utmost care as we roll out this vaccine.
Absolutely. Absolutely. All right. So planning is everything is something that we've already discussed in the program so far. So Dr. Panda, what is the level of planning so far?
Well, this is a very good question. I think 3P, I mean, while I was listening to Dr. Mohapatra and Dr. Gupta, 3P probably would be very helpful to have this discussion going. One is planning, another is product. So you have to have the product, the vaccine, and people. So planning is going on, and India has really, done things well ahead of the epidemic took hold or got a good grip of the country. So while the limited number of cases were detected, I remember that it was not even 500. While the country started going ahead with the lockdown and then the other measures in terms of increasing the testing. Similarly, as the vaccine-related research is now ongoing, the government has already started holding multiple consultative meetings, and as Dr. Mohapatra said, setting up the expert groups who are not only discussing how to distribute the vaccine by ramping up the existing facilities, but also who should go first in terms of getting a vaccine. And an important point that has been highlighted by Dr. Mohapatra is, I would like to underline, that community consultation would constitute a very important aspect of this planning. So this is not just planning by the government bodies or groups for people. People also need to be an active partner in the planning, and in that regard, the community consultation would be so very important, and that is happening now. So I think that India is moving in the right direction. But of course, although majority would wish that there is a vaccine, it comes as quickly as possible, but vaccine hesitancy is another issue that needs to be addressed, because there are a whole lot of concerns around vaccines as well, because people would think, oh, okay, in this process of fast tracking or getting a vaccine fast, is the issue of safety being bypassed, or will it be as efficacious as it should be? So there are questions in the minds of people. So that's why community consultation should constitute, and it is actually being considered actively by the government of India and also the state health authorities, that how to get the community concerns in account or in consideration, so that the planning becomes a participatory, inclusive process of planning rather than just unidirectional top-down approach.
Absolutely. The role of society, consultation, all these aspects are extremely important. Another important aspect, of course, Dr. Madhu Gupta, is the fact that we need to build capacity as well. We've seen over the last 6 months that we've done a fantastic job really as far as, PPE kits and ventilators and all the other infrastructure is concerned. But going forward, once the vaccine is eventually ready, we'll also need to have, enough cold storages, vials, syringes, and everything else that goes along with it.
Yeah, definitely. So we need to have enough logistic support and infrastructure, although we have the logistic support, and also we need to focus on the cold chain maintenance. So like we have this electronic vaccine intelligence network, even, so which makes the things very easy. And our Prime Minister of India, Mr. Narendra Modi, also focused on digitalized India. So this is one of the innovation where we already Ministry of Health and Family Welfare is using this technology to basically monitor the temperature where the vaccines are being stored, and also monitor what is the stock of the vaccine at various health facilities. So similarly, we can use this technology in delivering the COVID-19 vaccine also. And from the center level, we will be sure that this is the point where the vaccine needs to be supplied, or there's enough stock, or there is an interruption in the cold chain. And other things which you have mentioned, those are also important, that syringes and needles and vials, although vials will be provided by the manufacturer. So, this biomedical waste management related things, which is already there. Actually, we are running this immunization program quite well in the country, and these things are already there. But additional supplies are required for administering COVID-19 vaccine.
Absolutely. And Dr. Mohapatra, what is the biggest challenge that you see going forward, really? And how do we overcome the challenge?
I see it in terms of two, three aspects. One, reducing vaccine wastage. Because initially, when we have a vaccine ready and we are rolling it out, we should not waste anything due to cold chain issues, as was rightly highlighted by Dr. Gupta, or any other aspect like in terms of wastage in the outreach. So those things must be taken care of. The other already highlighted and much discussed is equity. How do we manage equity issues, ensuring that everyone has access to the vaccine irrespective of their vulnerabilities or disadvantages. And there again, Dr. Gupta has already highlighted our experience with Mission Indradhanush 2.0, where we prioritized aspirational districts. So in India, of the 718, whatever, odd number of districts, about 1/6 are aspirational districts, which are the most disadvantaged. And we have already been intensifying our immunization efforts in those districts. So going forward, we have some experience there. Now, the bigger issue that I see is India per se is a huge population. It constitutes about 17-18% of the global population. And if you look at the low and middle income country setting, it constitutes about 22% of the population. So, and India is also the biggest manufacturer of vaccines globally. That said, it has immense leadership potential for India to take up in terms of vaccination against COVID, and of course, not just at the regional level, but at the global level. So it calls for wider cooperation at the regional and global levels. Massive co-learning, cross-learning, those aspects have to be there. And at the same time, India must help out its neighbors, which is already the intention is there, and we are trying our best to help out our neighboring countries in the region in terms of building their participating in research capacity building efforts, vaccine knowledge sharing efforts, and wider collaboration with the global north, which is apparently which has better science in terms of evolution. So we are already collaborating with them. So those aspects are being handled. So those are some priorities which are already being addressed.
Absolutely. All right. So, Dr. Panda, let's go back to a point that was raised earlier. Just a passing mention was made about training and how important it is to train, the human resource as well to actually go ahead and administer the vaccine once it is ready. How important an aspect is that?
Absolutely. This is a very important question. Even if we have the willing people or population groups and the product available and the planning, now training should constitute an integral part of the planning. And the training could happen and should happen within the country, and as Dr. Mohapatra said, in the neighboring countries as well, because the disease does not require a passport, neither does it respect a border. So if we think that we are okay in terms of having an adequate trained human resource and we are all experienced with vaccination, so we'll be able to take care of India and Indians, and that's it. Probably that is not going to end the game or end the pandemic, because it's pandemic by definition. It's a problem to the globe. And if we do not help out each other in terms of helping neighboring countries to get trained human resource if they require so, then the game will not be won by us. So I would say that training is very essential, training at multiple level of the healthcare workers, and not only within the country and in the states where it is required, but also the partnership. So my fourth P, I have this habit of remembering for myself, not for others. So partnering with the neighboring countries would probably be the key to fight out COVID-19 epidemic successfully.
Absolutely. Another issue that I see coming up at some point in time, Dr. Gupta, is the fact that we have to scale up and scale up really fast because, we have a huge population. Over the last few years, few decades, of course, we've been carrying out immunization drives very successfully, but it has been for, targeted people, targeted public, and, it's been very focused that way. Right now, you have to vaccinate the entire populace of the nation, and scaling up at that scale could be an issue going forward.
Yeah, absolutely. So that is why I think Dr. Handa has initially, he mentioned that it will be done in a phasic manner. So because there are issues with the supply side also. So we may not be having so many of doses at one point of time to cover the whole population. So we need to prioritize. So in the priority, as there are several documents which are available, like WHO, they say that the frontline health workers should be prioritized, or the elderly population should be prioritized because they are at a higher risk of dying, or the patients with comorbidities, they are at a higher risk of dying. So we can prioritize them. So it will be done in a phased manner. It has to be actually. So it's not that today only I'll be immunizing everyone. So that will actually pose a big problem, but that is not the case, and that is where the role of planning comes into. So we will make a list of due list will include the frontline workers, then the population more than 60 years, which is around 8 to 11% of the total population of the country. So and gradually we will be moving to the other age group. So that is how this problem of delivering everyone will be sorted. But we will, I think, because as Dr. Mohapatra has also mentioned, this expert group, they are deliberating on who should be prioritized in India and how this will be phased out. That is an important document. And once those guidelines are there, and I think from the national level, the list from the state level requirement has also been asked, and it has been compiled at the central level for the planning purpose, that what is the requirement at the state level to implement basically delivering the vaccine, COVID-19 vaccine. So once we have stock of all the situation, once there is a complete situation analysis and we have the guidelines on the prioritization, then we can make a better plan to implement. So, right. And also we need to monitor the side effects also. Also, there are studies which say that this is quite a safe vaccine and quite an effective vaccine, especially those vaccines which have reached the phase 3 trials. But still, we need to monitor. So,
absolutely.
Thank you.
And Dr. Mohapatra, what's the best way forward?
The best way forward is for the population to be very optimistic. So at the same time, be very careful. We are the research community and the government is getting you the vaccine at the earliest and trying to ensure that all safety measures are taken good care of and all regulatory and paperwork related delays are minimized. At the same time, access, thinking in terms of access, but please don't lower your guards. Stay as protected as possible because we have festivities coming up, year end, and of course some fatigue. So wear the masks, stay protected till you get the vaccine.
Absolutely. And Dr. Panda, please close the show for us with your concluding remarks.
Well, in line with what was said just a few seconds ago by Dr. Mohapatra, I would say that even if we have the vaccines available, as it is going to be done in groups or in prioritized manner, continue wearing the mask and let us all try to make it a success by remembering that we need prioritization, we need people, we need planning, we need partnership. And without these, we won't succeed. So it requires people's participation as well. So people's health should be in people's hand. And so if we involve the community, there would be a success. I'm sure about it, but we cannot afford to lower our guards or lower down our guards. So it's not only mask, but the hand hygiene as well as the respiratory hygiene, along with the social distancing that Honorable Prime Minister was underlining yesterday.
Absolutely. All right. There you have it. Of course, the Prime Minister made an appeal on Tuesday to the entire nation, asking everyone to follow all the protocols, ensure hand hygiene, and also ensure that you wear a mask. The experts too today reiterating the same fact that go ahead and follow all the guidelines and protocols. Be safe. The virus is still a danger and still around. With that, it's a wrap as far as this telecast is concerned. But before we leave, we'd like to make an appeal to you as well. Rajya Sabha TV appeals to all its viewers to stay safe. Wear a mask, wash your hands regularly, and remember, follow social distancing, keep away at least 6 feet of minimum distance is what you should maintain as much as possible. Take care and stay safe.